ang napag-usapan natin yung about sa rotator cuff, di ba? Dahil nandito si Doc Peebles. Pero sabi ni Doc Peebles, kailangan din daw natin hingin yung professional opinion ng isa pa nating kasama dito. Of course, si Doc Janice, dahil mas expertise mo daw to.
Ganun ba yun?
Yes.
Naku,
So may
wala
part
palang
2 tayo.
airdrop tong...
Ito ba yun?
Ano nangyari kay Lito?
Tinanggal ko na para
tinanggal ni
makita yung
Rina.
muscles.
Pero mahirap. Ay, hindi pala to pwedeng
Mirror?
mag-mirror yung iPhone, yung yung iPad ko. Ano pa bang gusto nyo malaman dun sa rotator cuff?
I-refresh natin ano ba yung muscle
Ayun, no?
group na nandun sa
Janice.
rotator cuff natin.
Ayan, okay. The rotator cuffs, Rina, ginawa mo. The rotator cuffs kasi, there are 4 muscles that actually comprise it, no? So yung supraspinatus, basically, yun yung nasa taas. Okay.
Teacher, saan?
Teacher talaga. So ito yung dito yung sa supraspinatus natin. And then yung infraspinatus nasa likod yun, nasa ilalim. And then yung subscapularis, kaya siya tinawag na subscapularis kasi kung ito yung, can I borrow this one? Kung ito yung scapula, ito siya. Siya yung nasa loob, tapos attaching siya dun sa tinatawag na, this is the humeral head, no? So, attaching siya doon. And then yung isa is yung teres minor, yung nasa ilalim naman nun. Now, you can have, ayan, there. Now, you can have different kinds of tears there. Pwede kang may tinatawag na partial tear, pwede kang bursal-sided tear, pwedeng articular tear, pwede ring full thickness tear na tinatawag. Ngayon, yung tinatanong nga kanina ni Rina, sabi kasi daw ni Manny is,
2009.
Noong 2009, nagkaroon siya ng injury, nahulog siya sa jet ski. Tapos, anong nangyari? Bakit mula noong 2009, hindi naman siya nagkaroon ng surgery or anything? Na pwede kasi na partial lang yung tear niya, na nawala naman yung pain niya, and if he was able to do some conservative management like physical therapy, strengthening the other muscles surrounding the shoulder area, pwede talaga na nandun lang yung tear, pero mawala yung pain niya. Now, over the years, because of his repetitive actions, because of yung boxing nga niya, posible na nag-progress talaga yung tear. And pwede rin nga na may isa na naman acute episode, like possibly itong last fight niya with si Mayweather, na syempre, he was giving all that he has got. Kaya lang nga, meron na siyang injury. So, posible na mas lalong nag-progress niya yung tear nung day na yon. So, kasi yung, although yun nga, I'm not sure which of the 4 rotator cuffs did he tear, but the mere fact that Dr. Atrache said na it was a significant tear to need surgery, then it must be a big one talaga. So ngayon, ang ginawa naman yung procedure is arthroscopic repair. So what we usually do with arthroscopic repair is we make at least two small incisions on the shoulder joint, papasok siya ng camera and then the instruments, and then he puts a suture anchor or a suture anchor, basically meron kang suture na gagamitin mo pang tahi nung rotator cuff niya back to the bone or back to the tear, and then yung anchor ilalagay, ibobore mo yun dun sa buto ng pasyente, and then you repair the tear. After that, the patient has to undergo months of rehab. 1, to make sure that the range of motion is full. 2, to make sure that the strength is back. Ngayon, normal individuals will take around 4 to 6 months bago mag-return to sport. But since he's an elite athlete,
So, 9
he may
months.
need longer na rehab. Kasi kailangan talagang strong yung muscles niya. Oo, para bago siya maka-return to play na tinatawag natin. Ngayon, posible naman may mga pasyenteng, hindi naman kasi lahat nga ng pasyenteng may rotator cuff kailangan ng surgery. Kung maliit lang yung tear nila, nawala yung pain nila, hindi sila elite athlete, pwede naman na hindi mag-undergo ng surgery. Kaya
Depends
lang,
on the work.
yung strength nung shoulder is obviously weaker than one shoulder na walang tear. Kasi, ano ba yung function ng rotator cuff na yan? As the term implies, is it makes your shoulder rotate. it makes your shoulder move. So yung pag-akyat, pag-angat ng shoulder,
Adduction,
pag-external and internal rotate ng shoulder mo, tsaka yung movements na ganyan, yan yung function ng rotator cuffs mo. So imagine if one of those, like your supraspinatus, kunyari napunit siya, hindi malilift fully ng pasyente yung arm niya kasi punit
So,
yung
hindi full yung
superior.
ROM niya.
Or hindi full at saka weak. Yung iba, kayang i-lift, pero pag nilagyan mo na ng resistance, hindi na niya kayang labanan kasi punit eh. Siyempre, pag punit siya, masakit siya, hindi niya kayang labanan. So, yun yung isang nang hindi mo i-repair, lesser yung strength ng shoulder na affected compared sa isang pasyente who underwent a repair, mas may chance na mabalik talaga yung full
Sir,
strength ng
after
shoulder.
the surgery and after the therapy, ganun pa rin ba yung strength na mapapakita niya after 1
That's
year
why
siguro?
he will
1 year?
need a good, one, surgery should be really good. And yung kay Manny, since mukhang magaling naman yung surgeon, he's performed surgery on Kobe and Brady. So I think he's a really good surgeon. And obviously, second factor would be good rehab protocol talaga. The patient has to be very disciplined with regards to dun sa physical therapy. Kasi no matter how good your surgery is, no matter how good your surgeon is, if the patient does not undergo good physical therapy or rehabilitation program
Wala din
afterwards, useless yung surgery mo.
How do you injure that? Kasi kung if you just bump it, you'll be able to injure it? Or you
Normally,
have to
kung yung outstretched
hyperextend it?
hand tapos magaganon mo siya. Or yung repetitive na ganyan. Or normally yan yung mga factors or direct trauma, tas na ganon yung shoulder. Pwede rin kung sobrang heavy yung weight na nalilift mo. Pwede. Yung mga ganon yung actions that can actually cause injury. But mostly is yung repetitive actions
Repetitive.
ng overhead sports.
Hindi yung bangga.
Pwede.
Pwede yung
Depende
bangga.
sa impact. Depende sa kung gaano
Once
kalakas.
nagkaroon ka na ng surgery, mas prone ka ba agad-agad dun sa ganong injury ulit?
Well, ako sinasabi ko kasi syempre mas maganda pa rin or mas stronger pa rin yung original
Set of muscles.
set of muscles mo. So obviously, kung naoperahan na siya, obviously, mas weaker yun compared dun sa wala talagang injury na side. No? So, pwede pa rin na you can repair a surgically repaired shoulder. Pwede pa rin talaga yun.
How would you know kung may tear yung
Masakit
rotator
siya.
cuff?
The first symptom would be pain. Tapos yung iba, pag natutulog sila sa gabi, tapos nahigaan nila yung side, nagigising sila kasi severe yung
Ganun
pain.
kasakit.
Oo. Or parang hindi ko na ma-lift yung bag ko with one of my shoulders. But ganun, dati naman kaya ko siya. But the main symptom will be pain talaga. Pain and weakness of the shoulder.
Tapos tama ba intito ko, Doc Janice, na kung hindi siya ooperahan or pag walang ginawa, hindi siya magkakabet or hindi siya mag-heal na like the original?
Lalo na if it's a big tear. Pwede talaga na hindi na siya mag-heal on its own. Now, yun nga, yung iba na hindi naman inooperahan, chances are, may punit pa rin siya. Kaya lang hindi ganun kalaki yung punit, maliit lang siya. So the patients can do away without doing surgery because the pain is not as bad or nawala na yung pain.
It depends on the work of the person
Yun
din, di
din,
ba?
depends on yung activity talaga ng pasyente. Kasi kung overhead yung activities niya palagi, manual laborer siya, or yun nga, athlete siya, say badminton player, tennis player, volleyball player, or yan, boxer. So, every time gagawin niya yung movement na yun, nagpe-pain siya. So, pagka ganun, kailangan mo siyang operahan.
So how do you prevent this? I mean, syempre, of course, stretching is one.
Strengthening
Pero-
and stretching exercises will be a very good, let's just say, factor that would aid in preventing this.
What about yung pag-use ng kinesio-tape? Di ba may mga kinesio-taping tayo na
The
ginagamit?
kinesio tapes kasi basically what it does is it makes your muscles contract in the normal,
Range of motion.
yung normal
na galaw niya.
fiber, yung length ng fiber.
Doon mo siya ipupull, di ba?
Oo. Can it protect? I'm not so sure. Posible siguro. But I'm not so sure with regards to the kinesio
Kinesio tape.
tapes. So, mas siguro yung strengthening talaga.
So lalo na siguro dun sa mga athletes or dun sa mga tao na ang trabaho, it requires talaga repetitive action
Yes.
dito sa area ito. Siguro nga tulad ng sinabi ni Doc Janice, yung strengthening and stretching is very important para hindi na maka-encounter ng ganitong klase ng
Tsaka yung
injury.
sinasabi ko rin nga, like kanina sinasabihan ko si Rina, no? Kasi kung kunyari ikaw, say, hindi ka naman sanay sa... Ang isang common din pala nito is yung mga biglang nag-gym, tas sobrang bigat ng binubuhat nila.
Yes.
Parang minsan ano ako dyan.
Oo, kasi yung mga
Guilty ako.
delikado yun kasi kung hindi ka sanay, yung muscles mo hindi ganun kalakas, posible mo talaga ma-injure. And yun nga, meron ako mga cases ng mga pasyente, ganun nangyari sa kanila. Parang biglang after lifting, kunyari, sanay ako,
Oo,
binubuhat ko lang
bibiglain kasi.
10 pounds. Tapos biglang kina-excite ako. Gawin ko kayang 20. So, doble na, di ba? Tapos biglang pag ganun mo, biglang
Napunit.
aray, ba't ang sakit? Kasi hindi siya pasanay ng ganun. So, kailangan talaga yung strengthening mo, gradual. Hindi rin yung gusto ko na ma-strengthen siya, buhat ako agad ng 20 or 50 or 100. Kasi ay may injure talaga ikaw.
Paano ko, Doc Janice, yung mga nagko-crossfit, tapos pinush yung sarili kasi cute yung trainer?
Maliw ka. Baka tayo na. Ay, thank you muna kay Coach.
Biglang no comment ako eh. Hindi na talaga nagsalita.
So, bakit talaga yung katawan ko, pinush ko yung sarili ko ng
Talagang
CrossFit.
pinush talaga.
And thank you na rin pala kay Coach Brian Atienza at kay Coach Jason Monteverde ng CrossFit.
Maganda naman yung
Pwede.
CrossFit eh. Don't it's a good activity. It's a good exercise. Kaya lang what I usually tell nga my patients is, it's for hardcore talaga eh. So, kailangan very
Start slow.
fit ka. Oh, start slow, go low. And then you gradually progress. Pero it's a good
Nabigla ata ako
workout.
nun eh.
Oh, hindi ako magtatakang
100 na
mabibigla ka.
burpees, 100 na squats, tsaka 100
At saka under time pressure
Yeah,
siya
under
eh.
time
Minutes,
pressure.
diba?
8 minutes yung first nila for beginners.
Kailangan for, siya, yung medyo fit. Hindi yung from zero workout to, ay, gusto kong magpaka-fit, mag-crossfit ako. Medyo delikado yan. Pero, kasi kailangan lang yung coaches, they would know when to push and when to back out. Yun lang naman yung dun. But, okay naman, okay na workout. Maraming Yung friend ni Reg, nagko-crossfit.
Si Des.
Si Des.
Sige, minsan bumalik tayo. Intermediate naman yung subukan mo rin. Or yung hardcore na talaga. Anyway, thank you so much, Doc
Okay,
Janice.
sana may natutunan tayo pa rin
Of
sa kanya.
course.